I'm a dental hygienist here to talk about all the toothy topics. I'm live, 7 seconds in. Oh, wait a second. Oh, some people are here already. Whoa, we can get this party rolling right away. This is so exciting. Thank you for being here. So, okay, we're going to talk about all these, sorry, as I get situated, we're going to talk about all these teeth. If you want to talk about dental hygiene school, dentistry as it is, dental questions, dental health, my life of dentistry, whatever questions you have, I'm here to answer to the best of my ability. And also, last time we did this, don't forget to use those super chat stickers. Wait, the stickers and the super chat, they're two different things. YouTube has all these really fun things you can use now to make these live chats even more fun. I almost said funner, but you know what? That's the Monday night we're having right now, is using the word funner. So hello everyone, thank you for being here. Okay, so how excited are you all to talk teeth? Because I'm excited to talk teeth. I got my aligners in, so if I'm lisping, that's why. I only have one more tray left on the bottom, and each tray is 2 weeks for me, what I'm doing. So everyone could hear me, right? I'm assuming you could hear me. I need to look at the chat. Let me know if you can't. Let me know if you can. Patsy, you're only 2 hours behind instead of 6 hours ahead. Thank you for being here. Oh, I'm so happy I opened the chat and saw you. We were just DMing. I love that. Oh my goodness. How fun. 2 hours behind me. So I'm like in the dark here and you're still living your nice evening. So Invisalign, I'm almost done. I got 2 more or 1 more. I got 2 more weeks, 1 more tray, and then the bottoms are done. I'm not loving the top, so I'm going like backwards a little bit. It's going to be a whole thing with the top, but I'll still be done probably a few months. If anyone wanted to know. Hi from Detroit. You're in the same time zone as me. Love it. We are Central Time, I believe, right? Detroit, I would assume. Now, what is it saying? It's giving me an alert. Oh, see, this happened last time because I'm seeing you all here on my phone, but I also have it open on my computer over there, just in case I can't read the comments because it's too quick. Hello, when I grow up, I want to be a dentist. I'm so excited for you. Live your toothy journey. You're going to be an amazing dentist. Hi from Ohio. Ohio might actually be Eastern time zone, yeah? Depends what part of Ohio. Someone asked me why I don't love the top. Okay, we'll get into all your toothy questions while we're getting all settled. But I will tell you one more thing about me. The top teeth, I should say I and we didn't realize, I don't want to say realize, but when I saw the before and after scan of what my teeth would look like, I just saw that this tooth, number 8, was straight. And I was like, great, perfect. Didn't look further into it. Didn't realize that between 8 and 9, there was going to be a little gap, a little dot. Dot meaning like an opening, like a larger opening. My hands, I've been playing with this like avocado squishy and I don't know how clean it is, so I don't want to take them out right now. I don't want to put my hands in my mouth right now. But there's this little gap that was never there before. And of course we could do IPR, like there's things you can do to make it better. I don't know. I just wanted to be very conservative I wasn't even worried. Long story short, I wasn't even worried about my top teeth as much as I was about my bottom. I wanted my bottom to be straight. There was a lot of rotation. The top was just like for funsies. Like, okay, we'll make that one tooth a little more straight. It wasn't a big deal. But as it moved, now I have this gap I don't like. So we're going to go back a few trays to where the gap isn't created. And then I'm going to be happy with that. So that's why I'm going backwards. Anyway, Nepal, good morning. Oh my goodness, Dallas. Oh my goodness, someone just asked me if I do CEs. Okay, so fun fact, I never wanted to be a speaker. It was never my intention to be a speaker. I love doing this on YouTube with all of you. I love being behind a camera. This is live, but I'm usually not live. I love being able to film my videos back there, like maybe some of you have seen before, and I could be like, cut, I need to say that better. I like to do a lot of research and studying. It takes me a long time to write a video script, right? I want to make sure everything is evidence-based, everything is based on science, everything is the most updated information. I don't love live always, especially speaking in person. A live like this with all you all my friends, we're all friends, this is fine. But yeah, long story short, to answer the question about CEs, no, I didn't do much speaking. I've done some panels. I've done a keynote before, which is like, what do you mean you don't speak? But it was like more about my life story, stuff like that. I've never done an actual CE informational presentation for dental professionals. However, fun fact, I didn't even expect to talk about this today. I'm doing one on Tuesday for the first time. However, it's virtual, so that should make it a little better. I'm really excited. It's for a study club, so it's like 25 people, so we're gonna be fine. But I'm really, really proud of my, I wanna say, someone just said I've been here for all your lives. Thank you so much. Please do a video on how to brush properly with braces and how to keep that note about braces. Yes, I have a video on that. I'll tell you how to find it. Thank you. So long story short, Tuesday, yes, I'm doing a CE and I am really excited because the topic is dental health misinformation on social media. That's what I did my master's degree capstone on, how to combat effective communication strategies to combat misinformation as dental professionals. So anyway, that's like a CE that I'm doing for dental professionals. But yeah, it's happening Tuesday. I'll let you all know how it goes. I'm sure if you follow me on Instagram, I will let you know. The braces question, I have a bunch of videos on braces and how to clean your teeth when you're in braces. Just search braces teeth talk girl, like type in braces teeth talk girl on YouTube or even on Google, and my videos will pop up. If you want specifically flossing, braces, flossing, teeth talk girl, that video will pop right up. Okay, Better Mouth. Hello. Thank you for helping spread the importance of oral care. Your friends at, they said fiends, but I'm pretty sure they meant friends because they ain't fiends at Better Mouth. Thank you, Better Mouth. Okay, so maybe if you all have been, that's really generous and nice. Thank you. I'm really happy to work with Better Mouth. I think if you all saw that was what do we call those? Are those the super chat stickers? They just sent me something and I'm really happy to be working with them. A lot of cool things coming soon with Better Mouth. They're laughing that they said friends instead of, or fiends. Better Mouth is an interactive platform. You probably heard me talk about it. If you've ever signed up for my free oral care guide, I have a bunch of links to Better Mouth from there. You've heard about my free oral care guide. Basically, they help make caring for your teeth at home feel less like a chore and more like an act of self-care. I love them. Everything is evidence-based on there. I'm one of the speakers and I've helped write all of the dental content. So everything is legit to my standards on there. And anyway, check them out. Thank you, Better Mouth, for being here. Someone just said, oh, Potsy, thank you. I love Better Mouth. So easy and fun. Someone just said, why does my tongue not have papilla or papillae? It does. Why are you saying it doesn't? It does. We all friends here. Someone just asked, flossing necessary? Okay, let's just get into the questions. Here we go. Flossing necessary for all teeth? Yes. Hands down, yes. Real teeth, fake meaning crowns, implants. You got to clean around all teeth always. Okay, Joshua, I just accepted my first hygiene job. I'm nervous. You got this. If you weren't nervous, it wouldn't be normal. I always say I used to do a lot of theater. And one of my acting teachers told me once, and this changed my life. So I'm going to tell you, Joshua, for your first day of work, if you didn't have those butterflies, that means you care. You know what I mean? And if you care, you can use that good adrenaline. Use it to your advantage. Use that good, in theater, right? Use that good adrenaline as energy. Go up there and perform. Same thing with work. You know this stuff. You passed boards. You have your first dental hygiene job for a reason. You're going to be great. The normal first day nerves are totally a thing, and they're going to do you right. They're going to help you be the best you can be, and you're going to do awesome. All right. I'm gonna answer more questions, toothy questions. Let's see. Where are we at? They're not opening. I just saw them. It's kind of stuck on the Better Mouth one, which I love. That was really nice. Okay. We're all friends. Caesar, yes. I love it. I'm seeing a lot of comments, not questions, so I'm just kind of reading the nice things everyone's saying. Thank you. How's my energy? Speaking of jitters and first day, and today, I'm gonna tell you a quick story. I had 2 appointments, allergy shot. I had like appointments, and they both got canceled, and they're unrelated. Isn't that really funny? So I was supposed to have a day of appointments, like traveling from one place, and everything got canceled. So I'm just kind of like, ooh, because then I was like, actually, this is great because now I have more time to do schoolwork, right? Because I'm in school, and so it all worked out. But I'm just kind of like, ugh. So please tell me my energy's okay, and I'm not falling, like my eyes aren't closing. I don't know what I'm saying. Okay, where are you from? Here's a question. Where am I from? I'm from Chicagoland. Can you hear it on my accent? So I will say, you know, if you follow me on Instagram, you see how I always do the, I don't know, I don't always, but I post like mean comments because I think they're helps me talk about them. Anyway, I also get a lot of funny comments. Maybe I should do a funny comment section. When I tell you, so many people, they say, are you from Michigan? Are you from Minnesota, Wisconsin? You know, all the Midwest states. Sometimes people say, oh, I hear that Chicago accent. Anyway, I got an accent. I've been working so hard to get rid of my Chicago accent and talking like a Californian. But it's really hard for me. I think it's just kind of inbred in me. I did a New York accent for a play once, but I couldn't do it very well. And I just memorized every line, how it should sound. I couldn't just like talk and sound New York. I remembered the words and that was it. Kind of funny. Okay. Oh, someone just said, I love how you do the famous smile. You're very nice. Thank you. I love those celebrity smiles. I think that's such a fun thing too. Thank you. Someone just said they don't know what a Chicago accent is. Let's go eat pierogies. You know my Polish heritage too? Or is that like an Indiana thing because of Pierogi Fest? I don't know. Regardless, maybe nobody knows what I'm saying. Okay, let's see where we are. A question. I get menstruation gingivitis. Is this common? Also, it is making it difficult to keep up with my Invisalign trays. Any advice? It is common. I actually have a video. You can totally, again, search. I think I put like period teeth talk girl. If you search the words period teeth talk girl, or menstruation teeth talk girl, I talk all about how gingivitis is a thing. Hormones play a large factor. They factor into your gums. So like there's a thing called pregnancy gingivitis. There's things that happen at menopause with your mouth and teeth and dry mouth and all this stuff. So yes, it is common. It's not unheard of, but there are ways to make things better. So during those times of life. So definitely check out that video of mine, but mostly, spoiler alert, it's a lot of home care and upping home care. There are some extra things you can do for your gums, like swishing with warm salt water during that time. Warm salt water is a natural disinfectant that can really just help kind of soothe the gums. There's a bunch of little tips in that video, so definitely check it out, and you're very welcome. Let's see. Where? Oh, I forgot. I have to click it. Y'all know, if you've ever been here with me before, you all know. I always forget to press refresh, and then I'm staring at the same questions. But I'm going to get better at this. Okay. Oh, hey, Whitney. I'm an RDH student from Saudi Arabia. Your videos have helped, so thank you. Wow. That means so much. You know what's so cool about YouTube and the social media? I know I'm about to do a whole presentation on misinformation on social media and all the negatives and how to combat it, but we can't dismiss and we can't forget how many positives there are. Like, how cool, Saudi Arabia, like that we're connecting. That's just so far and so cool. Okay. Do cavities have to be refilled more than once? The goal is no. That is not something that has to happen. I've seen fillings stand the test of time. I've seen 90-year-olds with fillings that they got in their 30s and they're looking pretty good. Like however, I've seen fillings that aren't looking pretty good in the next 5 years. Again, home care is key. Visiting your dental office routinely is So important, so they can continue to check those fillings and make sure they are intact. You never want to go too long not seeing a dentist, because they're the ones who will tell you if they're going to last or not. So, thoughts on oil pulling. I have many thoughts, but I will keep it short. My thoughts on oil pulling are: there's limited research to show its effectiveness. However, there's not many negatives that have been shown in this limited research, other than if you have jaw problems, TMJ, discomfort. If you're swishing for too long, you can hurt your jaw. Never spit it into your sink. It'll clog your pipes. Having said all that, if you like it, do it. However, it does not replace brushing and flossing. So that's my biggest thing. Whenever someone says, I oil pull, I don't brush and floss, that's where I have a problem. But if you're just oil pulling on top of proper brushing, proper flossing, proper all that stuff you're supposed to do at home, can't hurt. I mean, that I know of. I don't know if it's helping or hurting. There just isn't enough research. I would say the one thing that there's the most research about regarding oil pulling is dry mouth. If you have dry mouth, there's more solid, hard science evidence showing that it can help with dry mouth. So that's the one thing. But all the other stuff, if you like it though, you do it. You do you. That's what I tell my patients. And of course, always ask. I do need to put a blanket statement. I say this in all my videos. It's in my description box if you read it in this. Never, including me, never take advice from someone online who you don't know. If you are looking for individualized advice, always, always, always ask your individual dentist, your individual dental hygienist, for they have your x-rays on their chart. They can see clinically in your mouth. They know all your health history. They know what's going on to give you really, really good sound advice on your individual mouth. Everything I give is generalized advice. This is what happens. This is what usually happens for these types of patients. This is, so you can get an idea and kind of help you navigate what's going on with your mouth. And it will really help you ask individual, more specific questions to your dental providers, right? The stuff you learned from me. I just want to put that out there, that we all know that. I know we all know that. I need to say it, right? Someone's asking about water flossers. Someone also said, oh, it's Potsy again, my friend. You do you. Someone said I use the phrase you do you. They said they borrowed it from me. I use it so much in my videos, and I just think it's fun. Like, it's an easy way to say you do you. It's fair. I mean, so yes, water flossers. I think they are great. We were talking about gums earlier. So I just saw another question that I don't want to lose. I'm trying to, filling versus root canal. Right after, remind me, filling versus root canal right after we talk about a water flosser. So water flossers are great for the gums. This is what I tell my patients as a blanket statement, right? I don't love them to replace traditional string floss. However, there are certain patients that might benefit more than others from water flossers. Some people might be able to get away with only water flossing, right? If your cavity rate is low, if you have severe gingivitis gum disease and you're struggling with flossing, right? You know what I mean? There's so many, the goal is always to get to be able to use traditional string floss. But if that's what you love is water flossing and that's the routine, I love it. I love it for anyone who has gum problems. But if you have any cavity problems or you're worried about getting cavities, I tell most of my patients you need to use some kind of string, a floss pick, the traditional string, even a proxy brush. Love those proxy brushes. So that's my long answer for my short, or my short answer for my long. If you want my full informational video, just search water floss, string floss, teeth talk girl. I know all like the keywords to find my videos because I do it all the time when I refer them, but I know like sometimes when you're looking for videos of mine, you might not find them. So yes, water floss, string floss, teeth talk girl, it'll pop right up. I'll give you all the information. But hopefully that kind of answered like quickly. Love from London. Oh, I love London. I was there for like 2 days, maybe 4. I don't know. It was a short trip and I want to go back because we did not get to see enough. Okay, my other question, I was remembering it. I remember it. It was, how do you know if you need a filling or a root canal? Short answer, your dentist will tell you. Long answer, the way they find out, the way they determine whether you need a root canal or an filling is how deep the tooth decay goes into your tooth. So without like, I should get one of those. I'm going to get one of those typodonts that show like the enamel, the dentin, the pulp. Like I'm going to get one of those. So then when I do lives like this, I can show you on a typodont. Ooh, that's exciting. I hope I remember. Okay. So the enamel's up here. We'll say enamel's this part, tips, and this is the dentin. And then this is your like pulp. And then the nerve is in the pulp, okay? So once a filling goes through your enamel, that's when, or I'm sorry, once, I said a filling, once a cavity goes through your enamel and it's in this dentin part, that's when your dentist knows you need a filling because it's broken through the enamel. They need to clean it out because it's just going to keep going once it's in the dentin. So we need to clean it out. If you're filling, I keep saying filling. If your cavity is just hanging out in the enamel, that's when sometimes dentists will watch it and be like, maybe it won't move, right? So enamel watch, dentin filling. If it's that cavity, tooth decays in the dentin, you need a filling. Once it breaks through the dentin and it gets into the pulp area close to your nerve, because your nerve's in there, that's when you need a root canal. Because now it has reached your nerve, so your nerve is very important because it keeps your tooth alive, but it's killing the nerve because it's tooth decay, and tooth decay, a cavity is bad bacteria, right? So that's how they know. And how do they see that is on an x-ray. You take an x-ray and it shows you how deep the filling, I keep saying filling, how deep the cavity goes into your tooth. You know what's so funny that I keep noticing myself? When I was a kid, I never could get it right. Filling versus cavity. Like a little kid, like, because I loved going to the dentist as a kid, and I always said it wrong. And I'm doing that now in my like 1400th year of school. Just shows. Can't run from your past. Okay, let's see what else we got. Uh-oh. Caesar, I've gotten good at Googling things with your name before I ask you. Always feel free to ask. I love being tested too to make sure I remember how to most effectively, most efficiently find one of my videos, So someone just asked, are my teeth veneers? They are not. I have Invisalign on right now, so that's why they might look shiny. I have like teeth straightening aligners. They're my teeth. You can, I have a video, of course, that shows like me and my x-rays, and you could see that they're all my real teeth. But thank you. That is such a compliment. Thank you so much. Let's see. Hi. Are handheld floss wands just as good as string floss? So I'm trying to think what a handheld floss wand. I'm thinking you think like a floss pick. Some of them are small little floss picks. Some have a larger handle floss pick. How did you ask it? What did you ask? Just as good. It depends. There are times when I think you can use them just as well as you can use string floss. But oftentimes they are harder to use properly. So it's not that they're bad, they're just harder to use properly. We're talking about floss picks versus traditional string floss. If you love them, keep using them. Bring one to your dental appointment next time. This is what I tell my patients. I'm like, hey, if you use them, bring the one that you use to me and show me how you use it. Because I just want to make sure you're using it the best way you can. Right? I don't want to like send you home and be like, yeah, you're fine. I want to make sure you're using it right. So that's my best answer for that. Make sure you're using it right. I do have a generalized video. If you search how to use a floss pick, Teeth Talk Girl, you'll find my little tips and tricks. And I actually just posted a video of me using a floss pick on my entire mouth. So you can search that if you just go to my recent videos on YouTube. So and that's my story on that. I love it. You just need to clean your teeth. You know what? When I was in dental hygiene school, one of my professors said, if you can just get your patients to clean their teeth, to clean between their teeth with something, I don't care if it's a shoestring, as long as they're disrupting that plaque biofilm from sitting there. And I was like, wow, that's a thought. It's true. Are there more effective ways than others? Yes. But as long as you're using something, that's where we're going to start. You know what I'm saying? Any tips for people who have severe anxiety about the dentist? I do. my number one tip is communication. And I know that sounds so silly, but like when a patient tells me, when they show up and tell me, hey, I don't want to be here, or I'm stressed to be here, or I've always been a little nervous about then I know, and I can accommodate your needs right away, right? When you don't tell us, then sometimes I'm like, I wonder why maybe someone's acting weird. Maybe they're just quiet and not talking to me. And I'm like, maybe I can't help you if I don't know, is my point. So I've had some patients that call the front desk before their appointment and say, hey, can you please like mark it on there that I'm nervous so they know? And then there'll be like a little mark, dental anxiety. And I'm like, oh, perfect. Like, cause now I know, I mean, not perfect that you have it, but now I can accommodate your needs. If the office has nitrous oxide or laughing gas, we can offer you that if that's something that would help you. We need to find out why. Sometimes you don't know why you're nervous. Are you nervous about the pain? Are you nervous about the unknown? Are you nervous about the sounds? Like some people have sound issues where it's like, I just hate the noise. So once we find out what it is, we can help you. If you're not sure what it is, maybe it's a childhood bad experience that you just can't get out of your head. We'll work through it. And so I hope that's my best answer. And by the way, awesome that you're trying to get over that hump and going to the dentist with this anxiety, right? That's the first step, is making that appointment. Once you show up and you tell them what's going on, smooth sailing. The hardest thing is to get there, to make, making the appointment. It's kind of like working out. It's like, oh, it's like working out. But once you're working out, you did it. You're good. So I do have a video, of course, dental anxiety, teeth talk girl, or another one that has a lot of good tips of mine for dental anxiety is, do you feel like you're being judged? That's one of my videos. Like a lot of patients go to the dentist and the first thing they're like, please don't judge my teeth. They'll tell me like, please don't judge my teeth. And I'm like, I'm not here to judge. Like I'm here to help keep them clean or improve them, right? So I just don't want anyone to ever think we're judging you. We're not. Our job is to help make your teeth either from bad to good or from good to good. We're here to make your teeth better or maintain what you have. So long story short, judged teeth talk girl. Do I feel judged teeth talk girl? That video of mine, if you search it, you should get some, hopefully even more tips and tricks. Let's see what we do. Is there a way to like press heart, or what am I clicking? What does this do? I'm nervous what it just did. Highlight, save to your channel. Uh-oh. I think I just saved something to my channel. Who knows? Oh, there's hearts. I'm like, I feel like there's a way to heart. I was trying to heart you all. I saw some people were doing hearts. Thank you. Keep throwing hearts. It makes me feel good. Okay, so let's see here. Ben has a question. Hi, I have a question. I had a cavity filled, but I can still see some brown and I can't chew on it without it hurting. So does that mean some of the filling is gone, or what could it be? You still see some brown. The way you say still see some brown makes me question, did it always look like that when you first went home? You know what I mean? Or did it look good when you first went home and then you randomly started seeing brown? It's hard to say what could be going on. Maybe there's some staining around the filling, but that there's hurting with the chewing. I don't know how long it's been. Sometimes it takes some time for it to feel better. It could take some time for your tooth to heal if it was worked on, but my best advice is to call your dental office and ask them. Again, just because I don't know how deep your filling was, I just have no context. So my best advice is just call, and it's so normal. Don't think you're bothering them. Be like, hey, I got a filling on this day, whatever, so-and-so long ago, however long ago, and it looks brown and it's kind of hurting me when I chew. Just call and ask, and they might have you come in to take a peek, or they'll let you know if they know more than me. I hope that kind of helps, but I wouldn't say it's normal. I don't know how long it's been, but it shouldn't hurt. I hope that helps you. Shamrock Freddy. Hey, Whitney. I got Irish in me too. 25%. Hey, Whitney, I'm using my... Oh, you gave me... Thank you for this generous contribution. You gave me... That was so nice, Gavin. Okay. I'm using my 5 nights at Freddy's account. LOL. But just wanted to say thank you for being such a great leader. You're the best. Thank you so much. That was really nice. Shamrock Freddy. 5 Nights at Freddy. I don't know what that means. Is that a please tell me, is that I'm thinking it's a restaurant. Is that a restaurant? I don't know. I don't know what it means. Am I gonna be silly? Someone tell me. Shamrock Freddy, 5 Nights? Someone please tell me. I love it. Thank you. You're the best. Here I am like, I'm Irish and I don't know what that, but thank you. I love this account. I think that's so fun. It's a video game, someone said. Okay. You know what video game I used to play? Sorry, we're talking about teeth, but one of my favorite video games. I don't think anyone will guess unless I've said it before. Oh, it's a video game franchise. I love it. I'm gonna look into it. You never know, but I actually don't. Well, of course, Rock Band. I was a big Rock Band person, right? I love my Rock Band. But all that aside, my favorite like video game was Rayman. Rayman. Anyone? Oh, it's on PlayStation. I also had an Xbox. Rayman. He was cool, making me want to find my Game Boy. I think I had it on my Game Boy Color too. Okay, back to teeth. I suddenly got black triangles on my lower front teeth. What shall I do? Okay, so I'm thinking suddenly getting black triangles. That makes me question, did you just get a teeth cleaning? Because sometimes when you just got a teeth cleaning, sorry, I'm trying to press like on this and it's not working. Shamrock Freddy, that was so nice. I was trying to press like. Okay, so suddenly getting black triangles is kind of peculiar because they wouldn't just happen overnight. My thought is either you just had a cleaning, so now you're seeing your black triangles. The cleaning doesn't cause black triangles, it just allows you to see them, because oftentimes your black triangles between your teeth, they're filled with plaque and tartar. And then when you remove the tartar and plaque, then you can see them. So it just kind of exposes them. It doesn't create them. You don't want plaque and tartar up in there, right? So it's a good thing that it was cleaned out. That would be my best guess. But I don't know. Let me know. I mean, I hope I find where you went, my friend, with the black triangles. But if you're concerned with how they look, I don't think anything. You said thank you. Okay, good. Hopefully that answered then if you said thanks. But yeah, if you're concerned with how they look, always schedule an appointment with your dental office. They might send you to an orthodontist. Maybe there's some crowding, spacing, rotating they can do with some kind of clear aligners or braces, or maybe a retainer can hold them to be where they need to stay. So I hope that kind of answers your question. Someone just said best horror movie. So I don't know if you're having a side combo or if you're asking me my favorite horror movie, but I'm gonna answer. What's my favorite horror movie? So, I was just watching all those Beetlejuice TikToks and reels with all the actors, and this is a question they asked all the actors in Beetlejuice: what's their favorite horror movies? And so I was thinking about mine, and I never came to a conclusion, but I would say, The Shining is a classic. I watched that when I was way too little, but I wasn't scared. I was never scared of things. I would get a little like, woo, The Shining, That's a horror movie, but I don't think it scares me. It gives me the heebie-jeebies. Like, woo, it's The Shining. I have to think on that. But I could get into a scary movie. I just saw that Strange Darling. It's based on a Stephen King book. I was nervous I was going to be more scared, but I wasn't as scared. Okay. Get Out. Someone just said Get Out. I thought someone was saying, someone just said you 2018 is so good. And I'm like, I was so good in 2018. Thank you. That's where my brain went. It's like, yeah, I made really good videos in 2018. Thank you. So that must be a movie, You 2018. Oh my goodness, I'm going to look into that. Can I I just did a screenshot. You 2018. Hall West. Thank you. Okay, more questions. Sorry. Woo! I like doing a little teeth, a little normal, a little teeth. See, a little teeth, a little talk, a little teeth. Okay, normal life and teeth. Let's see, what do we got here? Where did it go? I was just gonna ask, someone was asking me something. Oh, is your background actually a dentist's office or a set? It's a set. It's where I film on my YouTube videos, so it's not a working dental office, but it is a real chair. Yeah, That's my answer to that. How do I know if I have locked jaw? How wide should you be able to open your mouth? What does a normal range of motion look like? Guitar picks 11. Everyone's range of motion is different. Some people can open their mouths wider than others. You'll know if you have locked jaw because it'll be stuck. You won't be able to open it or close it. Or it'll be stuck like this and you won't be able to open it. So locked jaw is literally where it's locked into place. If you're asking more about like TMJ disorder, having issues where it clicks and pops, again, asking your dentist is the best option. Well, if you put your fingers like right here, right by your ears, and you open and close, you'll be able to hear. Like you'll like to do it right now. Who's doing this right now? Do it right now. It's kind of fun for everyone to do this. We can all play together. So when you do this, press kind of hard. You want to press hard. It kind of feels good. You give yourself a little massage. And then open a little. And then close. Open a little. Every time I do it, I hear clicking, popping in my right ear. Anyone else? Let me know. Let me know in the comments. Who's hearing it? I'm hearing mine. Anyway, so my point is you can hear if you have something going on with your jaw from doing that. And that can give you an indication as to if you gotta take it easy. My best advice, if you have jaw issues, don't be chewing gum. Don't be overusing it, right? Let it rest. Oftentimes it's the muscles, right? Oftentimes it's not the jaw itself. Oftentimes it's the muscles. So you gotta rest those muscles, you know? The masseters, a lot of people get Botox in that area because, you know, you're overworking it, it's tight, and you get a little Botox and it relaxes. I've heard good and bad for the Botox masseter stuff. I mean, nobody even asked me about this, but I'm just letting you know. I've heard good and bad. I don't know too much about it. I can't wait to learn more. I will say a lot of people have said, oh, it helps so much if you have that like muscle issues. But if you're having TMJ issues with the actual joint, you need to talk to a dentist because they'll give you individualized advice. If it's just the muscle, easier to handle. You know, you can wear a night guard at night. You could work on not clenching and grinding. You can not chew gum. You can not over exacerbate it. You could, sometimes you could heat it. Sometimes putting warm, you know, compresses on your jaw can help it. I'm trying to just think of random things. I have jaw videos, TMJ, Teeth Talk Girl. You can find my specific tips. I'm just, what's coming to mind. Yeah. Everything I said. I hope that helps. But I really hope you don't have lockjaw because that's a for real situation. That's a difficult situation. Call your dental office ASAP, right? Because you need to be able to chew, talk, eat. Quality of life can be really affected with jaw issues. So it's easier to fix if you have muscle issue, harder to fix if you have a joint issue. That was fun. Did we all do this together? I'm picturing, I love Peloton yoga. And when I'm doing Peloton yoga live and they all say, everyone taking a breath together. How many people are here right now? 109? I love that. 109 of us could be taking a breath together. I just think that's such a cool sense of community. I love that about Peloton. So, 102. See, I said that and I lost a bunch of you. No. No, but I just thought about like how fun that everybody's, you know, doing that together. I don't know. It's such a sense of community. I love the Teeth Talk community. Speaking of community, I know I only have like 10-ish minutes left here, but I am so thankful for all of you being here today. I'm so thankful for everyone who watches my videos and comments and likes and subscribes and turns on your notifications and everyone who supports me in any which way. And I want to say extremely extra thank yous to everyone in the YouTube membership. I have the Toothy supporters, the Toothy advocates, and the Toothy enthusiasts. So those are like the paid membership. I really, really, really appreciate you all. Thank you, Potsy just said the real ones are here. I know you've been a long-term supporter, and I appreciate it more than you know. It helps, you know, my whole goal here on YouTube and in social media is to provide evidence-based information, right? There's so much misinformation out there, and I'm just trying to combat it, and all of you are helping by being here. So thank you. Oh my goodness. Sidness85, you should do another music video to Sabrina Carpenter song. You're so right. I've been thinking like, I need to find a song that's trending. And right now, I've never even thought like, oh my goodness, of course, Sabrina Carpenter. By the way, I don't know if I posted this one yet, but I've been doing the Guess That Celebrity Smile on Instagram and stuff like that, and on YouTube Shorts. And I've been doing it in like batches, like 4 or 5 people at once instead of just one. Anyway, I know she's in one of the batches, so keep that in mind when my Sabrina Carpenter comes up. But please, 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 please brush your teeth. It's just my brain. That's a Sabrina song, right? The please, please, please. Okay, love it. Thank you. Shout out to my friend who just said that to me because I might be doing it. Where did you go? Where did you go? Sidness. I'm taking a screenshot because I want to thank you. Sidness, 85. I just might. You know, the thing is, I'm in school right now and I probably won't be able to do any kind of fun videos like that until like December. But I'm sure she'll still be trending in December, right? Can you all assure me that she'll still be trending in December? So if I do a parody to please, please, please by then. Because, you know, I like to go all out. I like to go all out. So please, please, please floss your teeth. See, Caesar's on my same. Someone just says, yes, she's going on tour. Okay, we'll do it in December, maybe. I wanted to do more fun videos this year, which brings me to one more fun fact, and then I'll get to more questions. Because I still have, you know, we're good. I was gonna do till 8:50. I was gonna do 45 minutes, but we could do a full hour if we want, right? We could just keep talking. We're having fun here. We're all friends on a Monday night. Okay, what was I gonna say? Oh my goodness, I was gonna spoil something, but that's okay. It's not a spoiler. So one of my goals for 2024 was to make more fun videos. I used to do so many parodies, like Bodak Yellow. Remember anyone? No? I barely do. I'm like, do I even know it? Cardi B. Yo, piece of calc, you can hide from me if you wanted to. You tenacious. I got red scalers. They get bloody too. I don't know. But something. I loved doing those parodies, right? And I haven't done them since I've been in school because I've been so busy. But that was my goal, was to do more. And spoiler alert, I didn't do it wasn't a parody, but I did a fun, silly video for Halloween, and it's coming out on Halloween. And I think that's all I'll say. But it was so fun, and I can't wait to share it all with you. So I have a fun, in my, you know, there's different playlists. It's gonna be in my playlist, dental humor. You know what I'm saying? So don't worry, you won't get scared. Okay. So let's see. DHTF. Question, I'm pregnant. Congratulations. Since getting pregnant, I cannot stand the taste of blood. Every time I floss or water floss, now I bleed. So I haven't been. Is it okay to not floss while pregnant? So pregnancy gingivitis is a thing. You're more prone to getting gingivitis when pregnant, and that could be why you're bleeding when you're flossing, water flossing, etc. I would never advise to stop. If you don't, the taste, I get it. That's tough. Some ways to maybe combat it is keep the toothpaste in your mouth when you're flossing so you don't taste the blood as much. Keep toothpaste in your mouth. Maybe even swish with mouthwash and then floss. You know, somehow try to combat that taste of blood because you really want to keep flossing. I also really want you to keep flossing so you won't bleed. You know, the more you floss, the less likely you are to bleed. You do have pregnancy that's against you with the gums a little bit, most likely. Keep getting your teeth cleanings at the office, at the dentist's office. I've had some patients want to come in every 3 months instead of every 6 months when they're pregnant because of that. They're like, Whitney, I don't like the taste of blood. I'm bleeding. Can you help me keep my gums where they need to be? So, you know, when we clean your teeth more often, that can help. Maybe even try to turn your water flosser. This is what I tell patients. I try to tell them to turn their water flosser down. So like, say you usually use it at 7, maybe try it at 2. So it's still something, but it's not as powerful. So maybe it won't, you know, make you bleed, even though if you're bleeding, that, you know, it's a complicated answer. My short answer is no, you shouldn't stop. My long answer is find ways around it, you know. Also, hopefully, I always say make sure you use an electric toothbrush. If you're stimulating that gum tissue really well before you brush and floss, really try to brush before, because that should get your gums where they need to be. So then when you floss, maybe they're already like worked out a little. These are all anecdotal suggestions, but they're things that have worked with some of my patients. So I hope some of those tips help for generalized advice, but my best advice is to ask your individual dentist and or dental hygienist. Someone's asking if xylitol is good for teeth. Yes, it is. I'm I'm like, next, no. Some information on that. Xylitol, you know, there's xylitol toothpaste. I don't believe it to replace fluoride. Fluoride is the best. But some fluoride toothpaste have xylitol in it as well, where it's fluoride and xylitol. That's great. There's xylitol gum, mints, breath sprays. All this stuff's great. It really helps inhibit plaque bacteria. So can't go wrong, right? Oh, hello, Patsy. Thank you. Let's see. Oh, I was like, what does 32 myths mean? But it's months. You've been hanging out for 32 months. I love that so much. What do you think of IPR? Is it safe? Is it true braces, clear aligners could cause recession? Good questions. IPR is safe, of course, when done properly. And that's where we fall into issues, right? So I was just talking about this with my dentist who is doing my Invisalign. And she was like, we can try IPR if you want, or blah, blah, blah. And right, here's the thing. I know she will be so conservative about it. I've heard good and bad. It's anecdotal. Evidence-based, yes, it's safe when done right. Anecdotal, I've heard a lot of people say in the spots that they get IPR, they have sensitivity or this or that. But it's hard to say, is it really because of the IPR or is it just because all of the teeth movement and parts of your teeth are exposed that have never been exposed before? Was it really the IPR? So sorry that wasn't a good answer, but basically, I think it's fine. I try to avoid everything that will change your tooth enamel when it's not necessary, right? Like if you don't really need a filling because we're watching it, you know, I would love to try and wait. But that's where dental philosophy comes into play, and I'm making a video on this soon because I'm also all for the very liberal approach of, you know what? We know that's going to go through the enamel. Let's just do it now when it's small. You know what I mean? I know I'm talking about fillings now and tooth decay and not IPR regarding braces. And I know there's a second part to that question, but I just want to explain that there's so many different philosophies. And I think every individual case is so different with braces and clear aligners. So it's hard to give a blanket statement for that. But I think IPR is fine because I also know hundreds of patients that I've seen that have IPR and have no problems. You know what I mean? So yes, it's safe. We're fine with it. But if you're nervous about it, talk with your dental provider about why you're nervous about it, and they can explain to you how like they're only taking off like 1/4 of a millimeter. You know, they'll explain what they're doing, and it could give you some peace of mind. Is it true braces, clear aligners could cause recession? So this one, you know what? I'm screenshotting you because I don't want to give an answer to that until I know for sure. I don't know for sure, but I would say, again, quick movement of teeth. I don't want to give an answer yet. Stay tuned. You know why I'm hesitant? This is kind of like the genetics causing gum disease and stuff. When people are like, well, I have gum disease because it runs in my family. It's like maybe you were more predisposed, but more likely than not, the gum disease didn't happen just because it's in your genes. It probably happened because you didn't learn how to brush correctly from your parents who also have gum disease. You know what I mean? It's the nature versus nurture stuff. There's a lot of nurture involved and stuff like that, you know? So that's why it's hard to give an answer. I would say a lot of people say it happens. I'm trying to think, if I was on TV right now, what would my answer be? Like if I had to give a really sound answer on live television, I think that's what I would say. You know what? I need to consult with an orthodontist before I answer this question. Sorry, that's my answer. But don't worry, you know I'm gonna get to it. But I would say don't worry about it. Braces cause more good than ever causing harm. A lot of times people have bad recession because of a bad occlusion, because they bite wrong, because they have rotated teeth. This is what's causing recession, and getting braces will prevent the recession from getting worse. That's more likely the situation. But we're going to have to consult an orthodontist because I don't know too much about that. Wow. I love it though. I don't have a video to refer you to. I don't have, that's something I haven't talked about a lot. I feel like so many of my answers are like, yep, I've done this video, I've done this video. So that was it was fun for me. Sorry, it didn't give you, hopefully it gave you good. Okay, 10 minutes, 10 minutes. Ah, ah. How do I floss with braces on? If you follow me on Instagram, Patsy, please tell me that was an okay answer. Oh my goodness, I hope it was okay. Okay. Noah, I'm getting braces. Lots of braces. So we're talking braces now. How do I floss with braces on? Shabana, and then someone just said they're getting braces. Noah's getting braces next Wednesday. Should we? Okay, here's the thing. Braces, you're gonna have to work harder, right? Because you got these little guys on your teeth. Thank you, Patsy, saying it was an okay answer. You said good, but so you're more prone to plaque attaching to your brackets and stuff like that, and the wires and all this stuff. So you have to really up your home care game. You shouldn't be scared. You should just be prepared that you're going to have to work harder at home, right? And that's fine. I'm a dental hygienist. I love dental hygiene. I'm all about this stuff. I would say before my Invisalign, before my clear aligners, I had really good oral hygiene. I didn't think I could up it anymore. And when I tell you I upped it, I upped it. I brush after every time I eat, whether it's a snack or it's wild. How long did it take me? And what was the other question? How to floss? Oh, if you follow me on Instagram at Teeth Talk Girl, I actually just did like an AMA Ask Me Anything earlier today, and I have a link. It was one of my questions, something about flossing with braces. So you can find my video on there easily on my Instagram story, or you can also search floss, braces, Teeth Talk Girl, and my video will pop right up and it'll show you all the tips and tricks. Can males become dental hygienists? Yes, I had 2 males in my class, 2 men, and I know a bunch of very successful male dental hygienists, so definitely. Just like kind of how like women weren't really dentists back in the day. There was very, very few women dentists, and now I think it was like close, like 50-50. There might have been almost more women dentists. Accepted to dental school. I don't know dentistry as well as I know dental hygiene, but the numbers and stuff. But I know my point is, whatever you are, you can be a dental hygienist. And I thank you for listening. Thank you. So I feel like a water pick would be a must for someone with braces. You know it. It's in my video. You know it. You know it. Okay. Hey, Tita Girl. I love your videos. Thank you, Michael. What's the best way to get rid of surface stains and so I can whiten my teeth? Best way? Everyone hates this answer. Please don't hate the messenger. But your best way to get rid of surface stains on your teeth is a professional teeth cleaning in office with a dentist and or dental hygienist. That is the only way to successfully, effectively, efficiently remove surface stain. Can you reduce stains from forming and minimize the appearance of stain at home? Yes, using whitening toothpaste, brushing and flossing correctly. I have a bunch of tips and tricks. You can staining, Teeth Talk Girl. You can find a bunch of my videos. The big thing between internal and external tooth staining, external can come off easily at a dental appointment. We scale it off, we polish it off, we do all that stuff for you. Internal staining's a different thing, and you asked about whitening. So internal staining, you need to use whitening for that. So once you get all the external stains off, then you can consider whitening. I always tell patients, if you're going to try and whiten and you haven't had a professional cleaning in a while, you're just going to be wasting your time and money, because you're going to be putting those whitening strips, trays, gels, whatever you're using for your whitening, you're going to be putting it on existing plaque and tartar. That plaque and tartar acts as a barrier on your teeth. So you're just whitening the plaque and tartar. You're not whitening the actual teeth. You know what I mean? So it renders it ineffective. You really, really want a professional cleaning so you have a clean canvas to whiten with. Now, if we're talking whitening, you really want to use something with peroxide whether that's hydrogen peroxide or carbamide peroxide. I recommend ADA approved products. Then you know they've been tested for safety and efficacy. It will have a stamp of approval. The American Dental Association will be on there. Having said that, some products are really great that don't yet have the ADA approval, or they're still pending for approval. You know what I mean? It takes a few years. So I don't want to like dismiss really good products that just don't have the ADA seal yet. If you're in America, right? It's a whole nother story when we're talking about other countries, but I always say make sure it has the ADA approval. I'm sorry, make sure it has something equal to a product that you can find with the ADA approval. Meaning, if you're looking at a product and you're like, it has peroxide, but I don't know how much it's supposed to have and stuff like that, you know, look at a product that has the ADA approval. It's like a little hack. Check out how much peroxide's up in there, if it's carbamide, if it's hydrogen peroxide, see if it seems the same. Don't love that answer that I gave, but it's like a little tip that can kind of steer you in the right direction. But to really, really navigate what products are best is to ask your individual dental provider, because they know what products are available in your area. Trying to navigate it at home yourself is really hard. I'm going to tell you it's hard for me, and I know this stuff because oftentimes companies do not disclose the exact percentages of ingredients that they use. So you just don't know if it's going to work. You know what I'm saying? Don't waste your time and money. Just ask a dental provider who can give you one-on-one advice. Who just sent me a gift? What is this? Someone was, oh wait, maybe I sent you a gift. What happened? Somebody gifted. Wait, I'm thinking, okay, I'm going to butcher saying your name because it's a beautiful, cool name. Uglesa? I don't know. I'm so sorry, but I'm going to cut your initials. UB gifted 1 Teeth Talk Girl membership. What does that mean? Did you gift it to someone, or did you win one? Or I don't even know what it means, but I love it. UG, what you up to? Thank you for being part of our Teeth Talk community. I'm screenshotting this so I can look into it after in case nobody answers me. What does it mean? I love it. I think someone was gifted. I'm guessing, no, gifted 1 Teeth Talk Girl member. I'm thinking you gifted it to someone, which I think is really nice. That would be my guess. Oh no, someone's telling me they bought it. Okay. Either way, thank you for being part of the community if you came into it. And if you gifted it to someone, that was very nice too. Was dental hygiene school hard? It was a lot. It was a lot. You could, I don't know if you, it's very similar to, I want to say similar to nursing school in the sense that you're dealing with clinic and you're also dealing with science, you know, classes that are pretty involved. I had a really tough undergrad. My bachelor's degree, University of Illinois, Chicago. Shout out if anyone ever took any science classes up in that place. I'm very proud of it. I'm happy about my bachelor's degree in biology from there. But if you ever took oral up at UIC or physics, you know what I'm saying? That was the hardest time of my entire life. So compared to that, dental hygiene school wasn't as bad, but it was still a lot. Time management was of utmost importance. It was a lot. You were constantly working, studying, doing clinic, finding patients. You live, sleep, breathe. Your life is dental hygiene when you're in dental hygiene school. So I would say that's my answer to that. Hard wise, like, yeah, some of the classes are tough. I do remember like pharmacology being like, wow, I don't have time to memorize all these medications. Potsy's probably, if you're still here, you're probably like, uh-oh. Pharmacology was hard. There's so many brand names. There's so many drugs and medications, and they change in the generics and this and the antibiotics. Oh my. It was a lot. And I remember thinking like, I just need I'm pretty good at it now. I could name off heart meds like you wouldn't, nobody's business. But I remember thinking like, whoa, I didn't sign up for this. I want to learn about teeth. But it's really important because you need to know what your patients are taking, and a lot of medications affect your patient's mouth. Okay, I'm getting on a sidetrack. Yes, it can be very hard. All right, where am I? It means they gifted a membership and it gives it to a random viewer. So who got it? Who did you give it to? Yui, that was so nice. Okay. Oh my gosh, I have 1 minute. What? How did that go so fast? I was still scrolling through. Caesar, LOL. Caesar, I keep seeing you pop up. Thank you so much for being here and being so active. This is making me so happy. I feel like I'm hanging with you, Caesar. LOL, Whitney at making herself uneasy with her own answers. I know, because you got to be, and like I said, my blanket statement at the beginning, you got to be so careful. I want to make sure I'm giving generalized advice because, as you all know, every mouth is different. Dentistry is based on the individual. What works for one person's mouth may not work for another person's mouth. There's so much that goes into it. And so everything comes full circle. We were just talking about pharmacology, and there's so much that goes into dentistry. A lot of people think you just go in for your cleaning, you get them clean, you leave, yay. But no, there's so much. Health history. We're checking everything that has to do with your mouth. We all know, since you're on this dental channel, you probably know gum disease. Gum disease increases your risk of heart disease, diabetes, all these other things. Your mouth is the gateway to your entire body. What happens in your mouth can affect your body. What happens in your body can affect your mouth. It's all connected. At the beginning, we were talking about hormones and teeth. You know what I mean? It's all connected. So I think it's just really, really important to know that I love to have just like fun and silly time, like teeth, woohoo! But some of my videos get pretty serious because, like, as fun as it is, there's also a serious part to it, right? Dental care is it's very underrated. It's getting better. More and more wellness people are more excited to talk about teeth, and I just think that's awesome, and that's a huge reason why I'm doing what I'm doing with continuing my education, because I just want to really improve the well-being of individuals and communities, So thank you all for being here because you're all helping make that happen. And I just want to know what someone just said. Welcome, new members. We have fun. Woo woo! Yes, thank you, everyone. Again, if you want to support this channel on helping combat misinformation on social media, specifically dental health misinformation, of course, please like, subscribe, turn on your notifications, all that good stuff. Press heart up in here. Thank you so much for your support. And in addition, you can also, ooh, I see the hearts. That makes me so happy. Oh, makes my heart happy. And in addition, if you want to go that extra mile, feel free to join the YouTube membership. We have a lot of fun. We have behind the scenes. You get previews of future videos, topics, and there's like a bunch of other fun little things you get from being part of that membership. And thank you all for being here. We're 2 minutes over, but this is it. I hope to do this again. I plan to do this again probably in December when I'm on my winter break. So I'll see you all then. And if I didn't get to your question today, please DM me on Instagram at Teeth Talk Girl. Let me know that you were in this today. Like say that right away. Hey, I was at your Instagram live, and then ask me your question. I will try to get through to those today or tomorrow or the next day this week. And thank you so much. Peace, love, and teeth. Happy Teeth. It's Happy Teeth's birthday tomorrow. She's turning 4. Thank you so much for being here. Oh my goodness. Have a wonderful evening. Have a wonderful Monday evening and a wonderful